Good afternoon, everyone. Welcome to this week's Holistic Highlight. My name is Amy Homsey, and I'm with a company called My Holistic Club. We are located in the Tampa Bay area, but we also expand around the nation, as you're going to see today with my very special guest. And what we do here is real simple. We are passionate about helping people and passionate about natural health. And what we are is a holistic community coming together to help people with the body, mind, and spirit to work at an optimal level at a more affordable way. And we like to say we are your home-based holistic company for products and services. So again, welcome to the call. My name is Amy Homsey. I'm calling in from Tampa Bay, Florida. I have a very special guest on the line today. Let me bring him on. It is Dr. Phil Harris out of Indiana. Dr. Phil, how are you?
I'm good. Thanks for having me.
Awesome. Well, I'm honored to have you on the call. I just want the audience to know, not only are you a dear friend of mine, but you're also one of my practitioners that I rely on, and you've helped me immensely. And I'm so grateful to have you on our platform, My Holistic Club. So let me properly introduce you and go over some of your credentials. Folks, I'm not going to be able to go through all of them. There are way too many, so I'm going to shorten this. But Dr. Phil is a naturopath doctor from Indiana, but he works remotely and works with patients all over the country. I know I'm in Florida. He's in Indiana. We do Zooms all the time. So he's also a licensed clinical pastor. He loves working with people. He's an author. He's a speaker. He's been a guest host on radio shows. He's in the middle of, he's written books, and I know he's coming out with a new book, which he'll be talking to you about. But he's also has been the director of a metabolic clinic, the top 5 wellness centers in the country. He's very knowledgeable with nutrition, how the body works, how to get it in balance, right? He has over 30 years experience in studying of wellness, prevention, rejuvenation. And I know also you're great at counseling, and you have a degree in psychology. And I love this too, nutritional response and functional nutritional assessment you are certified in. Wow. Welcome, Dr. Phil. I love this. And again, like I said, I'm very honored to have you on here and to work with you on a personal level. So I just want to start by asking you a couple questions, because what we do here on the Holistic Highlight is showcase different wellness affiliates on our plan, on My Holistic Club, because they all bring different value, right? Everyone has a different method or different value or different information, because the end goal is to help people get healthier or let them know there's different options out there. So my very first question, Dr. Phil, is how did you get motivated to move into the nutrition and wellness field?
Well, without getting too long-winded, it was basically because a lot of my family members had been sick for lengthy periods of time. My daughter had a pretty severe case of eczema as well as chronic eye and ear infections, and the medical field just wasn't offering any stopgap for that. It just kept on and kept on and kept on using the standard approaches like antibiotics and creams and cortisones, and there was no real answer for it in a permanent sense. So I just got frustrated with that and began to seek other alternatives. And what I think should be mainstream is called alternative. But a friend of mine, Dr. Joel Robbins in Tulsa, was my primary mentor. He helped me to find the answers. He taught me a few things. One, he says, your body doesn't know how to be sick. It only knows how to get well. That was the first foundation that set me up. And then I began to learn how to remove toxins and poisons and pay nutritional bills. And so what I tell people is almost all the problems that you're ever going to face are basically 2 things. They're toxicity, meaning poisons, and they're also the fact that we can't pay nutritional bills with junk food. We have to have good food, and we have to have supplements these days because, quite frankly, we cannot eat food these days and expect to get everything we need, because we just simply don't have the same grounds. They're depleted. And then when I tested this out on my daughter, especially her, amongst other family members, it worked beautifully. The eczema faded away. The eye and ear infections began to stop. And so, I'm not a skeptic, but I'm a realist here. This needs to work. And it did. And she's free of all those and has been ever since.
Wow. I love it. A simple approach. Sometimes it just goes back to common sense, right? And you're right. We all have toxins. Toxins are everywhere, in the water, in the air, in the foods, in our clothing, even in what we put on our skin and our hair. So I love that. I think most people get into natural health because they've had their own health challenges, right? And maybe Western medicine wasn't the answer, wasn't helping. So I love that. Now explain your statement. And I know you told me this and taught me this, and when you said it, the light bulb just went off. So explain to the audience your statement about deposits and withdrawals in the body.
Well, yeah, sure. So how that happened was I was praying in my office a few years ago, late one evening, and just asking the Lord for insights even more on health and so forth. And all of a sudden I heard this just clear as day. Everything is about deposits and withdrawals. And then the whole room stood still. And I knew then that something, from God had struck me, so to speak, and my mind didn't connect the dots yet, but I knew in my heart that this was correct. And so I began to meditate on it a bit, and I began to see quickly how it all connected. Everybody's bank account fails because of too little deposits, too many withdrawals. If you go bankrupt, it's based on that. If you are going to have a relationship fail, it's based on bankruptcy. People go emotionally bankrupt. People don't make enough deposits in their relationships. That's what causes them to go south like that. And then also the body's no different. We just don't make the right deposits. We cannot expect to deposit a Twinkie or a Pop-Tart and get the nutritional deposits we need to pay nutritional bills. So one of the things I wrote about in a book that I helped to co-author, and was my chapter was all about this, really. I tell folks, look, if you go to the bank with marbles and you want to deposit marbles, it's the wrong currency. You can't deposit marbles at the bank. And if you go to try to do that, they're going to think you lost your marbles. So it doesn't really matter how good the marbles are. They're still not going to take them. And the body doesn't run on certain things that we try to put in it. It just doesn't run on those things. It has to have raw foods. It has to have clean foods. It doesn't know what aspirin and Tylenol are. Those things are foreign to the body. And I don't see, if you really study the data closely with the doctors that are not in this for selfish reasons, you're going to find out those things just simply don't work the way they're supposed to work. And so everything is about deposits and withdrawals. And lastly, on that topic, without getting too deep into it, everybody listening to this call right now is a deposit and a withdrawal. Somebody made a deposit. It's called a sperm. Somebody made a withdrawal. That's called a delivery. So this is a big deal, although it sounds overly simplistic. I'm just letting you know, people are sick because they're going nutritionally bankrupt, and also because they're putting in wrong things, which are toxins and invaluable foods.
Mm-hmm. And I know one other thing that you have said many times, which makes sense, is your body is not deficient in Tylenol, or it's not deficient in any medication, right? And
Right.
Natural health or holistic health, whatever you want to call it, is about getting to the root of the problem,
Yes.
not necessarily masking symptoms, right? So,
and I want to say one more thing. I'm not against emergency medicine for our listeners. When you in an emergency, if you fall and break your arm, if you're going to the dentist to get your teeth drilled on, you don't need a glass of carrot juice. You probably need a drug at the moment. Okay. It's just that you don't need to be living on these, but I don't know if our listeners know this, but in America, 6 to 10 medications is average now for people over 40. 6 to 10 meds. And that's not the most I've seen. I've had clients that were taking over 20 of them at the same time. It's
incredible. Scary. Absolutely incredible. Now, Dr. Phil, let me ask you a personal question, if you don't mind.
Okay.
How old are you?
I'm 65.
And how many medications are you on?
I'm not on any at all, and I can deadlift 250 pounds.
So would you say you're an anomaly in this country?
Well, there are a lot more people getting on board, as you know. There's a lot more people getting on this health train. I tell people either fall in love with health and wellness, or sickness and disease is going to fall in love with you. And so you've got to find out how to make that happen. That's just a statement you have to live by. And unfortunately, we've been told a lot of lies that we're getting ready, I think, to see those lies revealed. And I think it's great for people to know this. But I hope more get on board, because I tell people it takes 40 years to figure this life out. And if after you're 40, and in this country right now, people over 40 have a chronic degenerative disease, probably 75% of them over 40 do. So if you're just learning how to live life wisely and smartly by the time you're 40 and then you're sick, that's not much fun.
Right. No, I agree. And then we're not going to get on this topic today, but I'll have you back. But then we have the whole emotional component, which also affects our health. But that is for another day. So I know you are in the midst of writing another book. Do you mind briefly sharing that with us? What is that topic going to be about?
Well, I have lots of ideas for books, but this one will be called Your Body is Not Impressed by Where Your Doctor Went to School. And I'll briefly tell you how that came around. It's another one of those times of prayer when I kind of heard this. See, the body is amazing. If you connected your DNA together, it would go from the earth to the sun 100 times. That's just one human. Just to bend over to pick up a pencil, your body has to talk to itself at 100 million signals a second to make that one motion. And so when you look at the fact that one cell in your body is actually a factory all its own, and then we expect a doctor to stand over it and tell it how to perform its duties, that's just not logical thinking. If you have 2 or 3 PhDs, I tell everybody, I've got a lot of paper on my wall, but I'm nothing more than an educated punk. When it comes to the body is so smart. It knows exactly what to do to get well if we can get out of its way and we stop poisoning it and we quit putting it in bankruptcy. But so many people live their entire lives eating dead foods, boxed foods, microwave foods, whatever, quote, tastes good. But the reason their tastes are so screwed up is their palate is so acid instead of being more alkaline. And what I do is help correct that and turn that around. And I've got some testimonies that are mind-blowing. And people will praise me for that. But honestly, I tell them, I point the praise right back to the amazing body. I said, listen, your body did all the work. You just simply followed my instructions, but your body did all the work. So thank you for the compliment, but your body has to get involved to get you well. And that's true for everything, including surgeries. If your body doesn't finish the surgeon's work, you're done. You're done. So you have to keep that in mind. So your body is never going to be impressed by where your doctor went to school.
I love that. I love that. Well, I'll tell you, I could talk to you all day. Obviously, we don't have time, but we will have you back on. Your concepts are just common sense and logical. And I love the analogies that you use. And it's just, again, just getting back to the basics. But you're right. It can be simple, but it's just about taking action, being proactive, right? And wanting to make these changes. And once you do, your body is going to appreciate it, right? So now for those of you who want to know more or get to know Dr. Phil, he is on our website. That website is www.myholisticclub.com. Again, he works remotely with people all over the country, as a lot of people are doing today. So I just want to thank you, Dr. Phil, for coming on here. I know you're extremely busy, but thank you for sharing some of your knowledge. And I do want to have you back because there's so many topics that we could discuss with you. And again, we want to empower you, the audience, to at least be open to learning new things. And being someone who's had my own health challenges off and on for 30 years, I never give up hope. And we want to give you hope and let you know there are other options out there if you are interested. So with that, thank you for joining us for the Holistic Highlight for this week. And Dr. Phil, take care. I'll be in touch soon.
Thank you. Great to be on the show.